Well, good afternoon, everyone. I'm letting the folks trickle in to our today's webinar. In fact, this is our first webinar of 2026, so thank you for joining us for our inaugural event on how quality champions are meeting the challenges of this flu season. The panel discussion today will be led by our very own Amy Harris, and I want to say our very own because we work with her a great deal, and so she's probably pretty much part of the NMQF team. But I think we don't pay her, and I think that she gets a paycheck from New York Health and Hospitals as their Chief Implementation Officer and Associate Executive Director of Ambulatory Care. But we also employ her to, that whole free labor thing that we get from her. Before we get into the webinar, I just want to give you two housekeeping items and a couple of announcements. One, to keep the conversation going, if you want to just sort of share some intel or things you've heard, please place those in our chat box, and we'll get to that and go and probably add that to the conversation. And two, if you have any questions that you'd like to ask of the panelists, put them in the Q&A box, and they will get those questions asked and answered. Finally, just for NMQF wide purposes, two things. We have our 40 under 40 applications out. So if you are or know of a good applicant that works a lot in minority healthcare, please nominate them or have them nominate themselves for the award. And that award will be given at our annual Summit on Health Disparities, which will take place on April 27th and 28th in Washington, D.C. And we finally have the registration up, so we'll send the registration link for that too. And that's all I have. Without further ado, I want to turn it over to people that are far more knowledgeable and experienced, and that's going to be start with Amy Harris. So, Amy, floor
Thank
is
you,
yours.
Brandon. Thank you for that introduction. I want to thank you, Chinny, Ashley, Leslie, your whole team for putting this together. Very excited today to talk about a really important topic, this year's flu vaccination situation. And we have a couple of ideas today and goals that we want to go over. So for today's topic, we want to make sure that we're all on the same page, that today's topic is going to cover flu vaccination. And we're going to talk a little bit about what we're doing here in the country to tackle flu vaccination rates, increase vaccination rates, what the situation is happening with the political ramifications happening around vaccines and flu vaccinations in general, what concerns we may have as an organization regarding vaccines. And in order to do this, we've invited two very special panelists to be with us today. So I want to introduce Michelle Lamb. She's an administrator here at New York City Health and Hospitals Ambulatory Care. Michelle brings to the table a lot of information that she'll be presenting today. She is a vaccine champion here in New York City. And today we also have Samuel Park, who is the Vice President of Ancillary and Diagnostic Services at Southeast Medical Group and Southeast Primary Care Partners. Also, who will be bringing to all of his expertise as a panelist and joining in on the conversation as we go along. And they will both be taking questions from the audience. And just a little background, what we know about the flu vaccine so far this year is that it is more severe and rapid spreading than most other seasons. In fact, compared to last season, we're seeing it's significantly higher, the rates of flu. And that's part of that is because that there's a new variant that it's called that KH3N2, which really came out after the vaccine design was put in place. So the current vaccine wasn't really designed to protect against this particular variant. However, there are components of the vaccine that if you get vaccinated will help you, if you get the flu, do better. You won't be as sick and you won't be sick for as long. And that's really important. What we also have been seeing this year is an earlier onset of the surge season, and that surge has been much more aggressive, and the surge happened much earlier and much faster. In fact, here in the city of New York, we saw the surge starting in November, which is unusual because we don't usually see the peak and the precipitous increase in in flu cases until much later in the season. And this time we saw a big precipitous jump in cases in December and even into some part of January. Although I would say we've seen data in the last 3, 4 weeks of decreasing numbers of flu. But in early January 2026, 11 to 15 million illnesses have been reported for this season, almost 200,000 hospitalizations, thousands of deaths, including children. So, with those kinds of numbers, we're still seeing overall lower rates of vaccination. So, you would think with those kinds of statistics coming out, there would have been more people running to get their flu vaccines, but that's not always the case. So we have two people on our panel today who can tell us about what they've been doing as flu champions to educate their communities, talk up flu vaccines, have their communities trust that flu vaccines are safe and that they work. And I'm going to ask a few questions. So what are you doing to promote the flu vaccine? Because you would think just with the data alone, people were going to come in, but that's not the case. So what have you been doing to promote flu vaccines?
So I can start. At Elmhurst, what we've done is, we know that it's important to first engage our own staff members. Our own staff members are the best champions that can help relay the message, relay the statistics, relay the benefits of what the flu vaccine can do. There's a lot of, patients or people in general who hear things on the news now about vaccinations. I'm not going to go into that, but as long as we have champions within our facility, our own staff who are able to speak to the benefits, speak to medical scientific facts about what flu vaccines is about, the benefits of it, I feel that that is the number one. We've worked with National Minority Quality Forum for over 3 years, or maybe about 3 years now. And every year, we learn something new. We learn different strategies, and we've done many learning initiatives with them, and we share that with our staff. So we provide staff with the tools needed to help move forward with education.
Okay, Sam, what are you doing as a flu champion in Georgia to get your community, the state of Georgia, communities in Georgia rallied around flu vaccination?
I think for us, I can echo some of the things that Michelle was just saying regarding staff and our providers. They are obviously our number one kind of promoters of the vaccines. Our patients really trust what our providers and staff have to say. So that was really key to getting us going or getting us started off really well. We also have a pretty robust social media platform. We have a great marketing team that kind of gets ahead of things. And so early and actually late July and early August, we started promoting a lot of the flu vaccine marketing material through social media, TikTok videos. We have Instagram videos, things like that that we were promoting it on, Facebook. And so we were able to really get a lot of, we made it kind of fun and entertaining for our patients. And so we had some patients really come in early, start asking about flu vaccines because of those marketing materials. One thing that really made us successful this year, I think, was last year we waited too late. So we waited like the official word from, I think the CDC is that we shouldn't vaccinate till like September. But what we noticed last year was that a lot of the pharmacies were vaccinating earlier than that, maybe about middle of August. And so we kind of did the same thing. We started opening up, at least for the higher risk communities. starting vaccinating a little bit earlier, about 2 weeks earlier. And that I think really helped us out a lot as well.
Okay, Michelle, what specifically did you do at Elmhurst to engage employees and patients in getting their vaccine? What specific activities?
So we know the population in general, people in general love themes, love swag. So we wanted to get our staff first excited about this coming flu season with the vaccine. So we did something nostalgic. We did like cute 80s, 90s theme where we had Pac-Man, a lot of the old movies. Such as we made little posters with Mr. T, Ghostbusters, the Golden Girls, things like that, and posted around to promote employee flu vaccines. And the T-shirt we created this year, I guess, was a big hit because not patients, staff really, really wanted the T-shirts. I mean, we had to put in another round of orders for it. We didn't expect it to actually be such a great hit. And then because more staff were receiving the flu vaccines, and some of the patients say, oh, it hurts, or I get a reaction afterwards. Staff were able to promote saying, well, this year it didn't hurt for me, or I didn't really get a reaction off of the flu vaccines, as they were promoting it to the patients. Another way we were promoting it to patients were, and this was very creative. Our new ADN in primary care, she was amazing. So we had little giveaways, like little beanie hats and gloves with the Elmhurst logo. And we were going around the waiting room asking patients, oh, did you receive the flu vaccine this year? And if they did, we verified that they did. We would hand them a beanie or gloves. And you had other patients in the waiting room saying, wait, why do they get that? How do I get, a pair or a set? And we tell them, all you have to do is get the flu vaccine. There are benefits for the flu vaccine. You don't get sick, or if you do get sick, you won't be sick for as long. And then we were very transparent about what was going on, especially mid-November into December, where our EDs were inundated with, patients who really didn't get the flu vaccine, or some who may have gotten the flu vaccine, but they were elderly or they were immunocompromised and they ended up catching the flu, had to go through the ED, had to get admitted. And we're transparent when we're communicating with our staff and patients about this. Don't get it, or if you have an immunocompromised or an elderly person at home who you don't want to bring this home to them, or bring a severe version of it home to them, and have them end up in the emergency room. Have them come in and wait for so long, or have them piled up in the emergency room, or waiting for an inpatient bed or such. And that, I feel, kind of hit home as well, along with, of course, handing out swag.
And I can say those Pac-Man t-shirts are cool because I got one and my kids love it. And so even though it's something small like that, I think our patients really enjoy that. We gave out things like buttons and even stickers that say I got the flu shot, and just little things like that. I think really helps a lot. So yeah, I think that's been great this year. That's something that's different that we did, that I got an idea from my time at Elmhurst actually.
That's wonderful. Let me ask you a question. Have you worked with any outside organizations, religious groups, politicians to kind of get the word out, or
Yeah. This
tell
is
me?
actually, sorry, go ahead. Um, it's actually another idea that I got from my time when I took my visit to Elmhurst. This year, one thing we did a little bit differently. So we are spread through all of Georgia, from the metro Atlanta areas all the way down to more the southern, more rural areas of Georgia. And in the rural areas, we often had some difficulty getting our patients to come in and get the flu vaccine. And so one thing that we talked about during my time at Elmhurst was using the local churches, or partnering with the local churches. And so we had some of our patients who were pastors or elders or deacons of the local church, and we helped promote vaccines or flu vaccines through those members. We got some time in front of the congregation, and got a little chance to talk about flu vaccines. So I think that part was very, very helpful as well.
Yeah, so at Elmhurst, we have a great relationship with our local assembly members and politicians, and especially during the start of the flu season, I would say late September, all the way up until mid to late no mid December. We host a lot of community health fairs along with politicians and assembly members. They help promote it on their social media to the communities. We promote it on our social media as well about where we'll be setting up locations. We also work with churches, other religious observancy areas. And this year we actually went into some public schools. So we went into a few elementary schools as well on Saturdays and Sundays to promote the vaccinations. The schools was something new, and it was actually a pretty big hit. We try to cover all bases this year. And we have this amazing, we call it our street health outreach wellness van. We call it a show van, where they park at different various parks, so to speak, where they have homeless encampments or homeless people congregate, and they promote the flu vaccinations to them as well. So we were able to vaccinate quite a few more community members through that.
Okay, that's very innovative to actually meet people where they are rather than wait for them to come to you, and doing that with different community groups, the show van, politicians. Speaking of politicians, we're going to we're going to talk about your actual flu rates, but speaking of politicians, has the current vaccine policy environment at the federal level impacted your vaccine programs, or how you distribute vaccines, or any of your vaccine programs at all?
You want to start, Michelle, or you want me to go? I guess I can go. So a lot of our patients, they tie in flu vaccines with other vaccines, such as COVID vaccines, RSV vaccines, etc. And so there was a time period, I'm not sure the audience, but especially if you work in healthcare, I think you remember there was a time period all throughout the country, not just here in Georgia, where there was a lot of questions about how COVID vaccines were going to be covered through patients' insurance. A lot of our patients, at least in the state of Georgia, we had to push them to the pharmacy. That what we were hearing was that the vaccines were only going to be covered with a prescription at a pharmacy. And so the patients would come to our office, ask for a prescription for the COVID vaccine, and then they would have to take that prescription to the pharmacy to get it. So just things like that caused a little bit of a barrier. Again, a lot of our patients get the COVID and flu vaccines concurrently when they come in. And so when they equated, well, there's having issues covering my COVID vaccine, there was some hesitation and delay in getting their flu vaccine as well, which was unfortunate.
So for Elmhurst, we're part of the larger New York City Health and Hospital Systems. It's the oldest in the US, in the country. Luckily, our president, I guess, I'm pretty sure with a lot of other, powers that be in New York State, decided that we were not going to create a barrier for our patients. We were still going to just go ahead and vaccinate. Of course, following the qualification guidelines for, like, say, COVID, for instance. We were just going to continue. We didn't want to cause a barrier. We didn't want an excuse for our patients not to get it, or we didn't want to create hardship for them to now have to go to pharmacy, or have to come here to get a prescription in order to go out to the pharmacy to get it. So we just gave it in our clinics. All of our clinics gave the vaccine, not just primary care. If you had a specialty appointment, the nurses, they offered the vaccine. You had an eye appointment, they offered the vaccines as well, all the vaccines. We did have, well, funny thing is, we did see a little dip in vaccine rates in certain populations, such as patients who identify as white, because of all the vaccine misinformation that was being pushed out. But funny thing was, historically, our Black and African American populations had the lower vaccine rate, but as of December, when we reviewed our data, our African American Black patients who identified as that, their rates were better this year than last year. But of course, flu season's not over, so at the end of the season, we're not sure how it's going to look. But this year compared to last year, I believe there was like a 2% increase in that population. And coincidentally like a 1% decrease in the whites population. All the others, because they know, they hear, and how transparent we were about the flu rates here at the hospital and what's going on in the community with people getting the flu, it didn't change too much. It may have taken the medical staff, especially our nurses, they're amazing, you know, a little bit more reassuring to our patients about the benefits of the flu vaccine, or, you know, debunking stuff that they've heard on social media and everything about how horrible it is for the body. It's been okay, I would say here.
Okay, speaking of vaccine rates, last year the country ended up with just under a 42% overall vaccination rate for the flu. Not that great. This year, we're doing slightly better, but of course the season's not over. But the overall trend over the last number of years has been a steady decline. In 2023, 2024 season, we ended at just under 45%. Last year it was just under 42%. This year it's slightly better, but again, we haven't finished the season. But so we're having declining flu vaccination rates. How are you doing at your facilities overall so far this year? And how do you keep track of all your data?
Yeah, so I'm been in charge of our flu ordering process since about 2022. So I keep my I have two ways of keeping our data. One is our ordering data, right? So I know exactly how much flu vaccines were ordered. And then the other way we do that is we have our data team that analyzes our charts based on their claims that are going out. We know which patients were given flu vaccines. And I saw something interesting, that 2022 year when I first started taking over a flu vaccine process, that if you recall, that was right after COVID. And so that was a really, really tough year for us when it came to flu vaccines. Nobody wanted that. We had leftover flu vaccines at the end of the year. We're only allowed to return about 15% of it. And we were left with an excess amount, and we ended up having to throw a lot of them away. We had a different trend in 2023, 2024 season. And it was the complete opposite for us, where we all of a sudden had a huge demand for flu vaccines. And I'm guessing it kind of follows. I think a lot of the patients that did not get the flu vaccine in that 2022, 23 season, they got sick and they realized next year I'm going to get the flu vaccine because we just had a huge spike in that year. And then last year it kind of decreased. Last year we had about 20. So, for instance, 2023, 24, we had about 30,000 doses of flu vaccines given out. Last year, it came down to about 23,000 doses given out. And we are right at that similar mark today. We're about 22,000 flu vaccine doses given out today. So it was just interesting to see that kind of trend from post-pandemic to that kind of peak that following year, and then kind of trending down like you were talking about, Amy.
Yeah. Yeah, very interesting. Michelle, how are you doing at Elmhurst, and how do you keep track of all your data? Because it's a lot.
So New York City Health and Hospitals has this wonderful data team, and they've created these wonderful dashboards out of our patient population, you know, all the information in our electronic health record system, Epic. They've created dashboards off of the data from there. Overall, this year, month over month, we do see an increase, slightly better than last year. I want to say, you know, at the end of December, I can say for our primary care department, for all patients who did come in for their primary care visit, about 72% of those patients did receive a flu vaccine. And, you know, mind you, in primary care, in any given day, there are over, I want to say 800 patients scheduled. This is between pediatrics all the way up until over geriatric age patients. So about 72% of our patient populations that had visits in December were vaccinated with the flu. And I want to say for our employees at the end of December, similar trend, we are doing better. 60% of our workforce is a little over 6,000. So 60% of our workforce have been vaccinated with the flu. So overall, you know, between patients and employees, we're 1 or 2% better than last year. And then we keep an eye on that to see, by age group, which age group is kind of tailing behind. And even with employees, like which employees or what departments are tailing behind a little. And we have this thing that we do here, the flu ferry, who'll go straight to the departments and they'll promote the flu vaccine in the department. Some of the areas where, they're really busy, staff just don't have time to either go to our pop-up flu clinic or down to employee health to get their vaccine. So we coined a flu ferry where they'll just fly to you and administer the vaccine.
That's very cute. How many does the flu fairy give out every year, overall? If you look at all of the stuff that Elmhurst is doing, if you have 6,000 employees, how many do you usually give out? And how do you compare to other H&H facilities?
Oh, comparing. I love comparing. So, Amy knows this. I am very competitive. That's why I love that H&H, the system itself, has created this dashboard because I'm able to compare my areas or Elmhurst Hospital's flu vaccine rates, even, any type of chronic disease control rates, anything to other facilities. And I'm like, oh, we're doing better than them. We're doing better than them. We're doing better than the average. So that's something we do with the flu vaccine as well. And then I'll share it transparently with the team to say, hey, look, we're number one. We're still doing the best. So we are actually doing the best in employee and patient flu vaccine we've administered. Our flu ferry, or during our flu ferry campaign, I would say, we've given out a good 3,000 vaccines through our flu ferry. The other portion, they'll come straight from OHS when they come in for their clearances, their annuals, or new employee hires. And then there's a small percentage where they receive their vaccines from an external source. But most of our staff, knowing that we give out swag, they rather come to us so they could get the t-shirt. Sometimes they get cookies or a lapel pin. They like the swag.
Have you ever used any of your flu data to develop any kind of performance improvement projects? Have you ever looked at your data and said, oh, wow, like here's our data from this year. Let's do something different next year to improve that?
I think
Definitely.
for us,
Go ahead.
oh, go ahead.
So for us, definitely, we always want to do better than we did the year before. So every year we create a new goal, 2% better than the previous year. And then we come up with what are different ways that we can promote and push out the flu vaccine. So for us, and for employees this year, we thought doing something nostalgic and coming up with a theme that can really hit home, or not hit home, but like make people think, oh, you know what, that's a cute shirt. Or I remember Pac-Man when I was young. They'll want the swag, they want the shirts. And then for patients, what we did with our employees were we made it competitive within each other. So at the end of the month, we see who gave out the most vaccines, and then there's like a small reward system or recognition system that we have here, and then we recognize those members, those team members publicly to say, this person gave out 500 vaccines this month. Everybody give them a round of applause and give them a high five and some Elm stars that we give out here.
Yeah, pretty much exactly the same as Michelle said. We essentially use our data to compare across all of our clinics. We have about 52 clinics in all. And so we kind of get an idea of one, total volume, but of course that's not fair. Some of our clinics are bigger than others. But we go by kind of that metric, and the other metric is just vaccines per patient or vaccines per visit. And therefore we kind of develop a little bit of a competitive environment. And we do give prizes out to the clinics that did well. As for example, last year we gave out some personalized tumblers to each of the staff members at a clinic. Sometimes we do like jackets and things like that. So we just try to make it a little bit fun for everybody. And that's how we kind of use the flu vaccine data.
Oh, I like the idea of getting a jacket for being like a flu champion,
Yeah,
like top-notch
exactly.
department. Yeah, I could see that working well here. No, I think that's great. And I think that each year, if you have the ability at your facility to look at the data see where you have, demographic groups that may need additional support and how you address those things. Maybe particular departments, types of employees.
Yeah.
How do you vaccinate overnight employees? At our hospital, we have tour 1, 2, and 3. You can't just have a pop-up flu clinic during the daytime hours because then you're not addressing all the people overnight. So you have to look at how are we going to, manage this for all 3 tours. So let me ask, what are some challenges or other concerns you've had or your clinicians have run into, and how have your teams worked through them? So what are some of the challenges or concerns in providing
Yeah.
flu vaccine or dealing with flu vaccine? I know I recently saw on social media, especially social media, well, I'm just putting it out here. I mean, this is the reality. Dr. Mike, if you don't follow Dr. Mike online, he's really great. Or Dr. Offit, who's a really well-known immunization expert. And you have people who are not medically educated, but are educated by the opinions of others on social media who feel that, they run by feeling. They run by the opinions of others. They don't follow the science. They don't trust healthcare providers. And so what are some of the concerns that you may have? Because Dr. Mike and Dr. Offit are saying, hey, this is getting harder and harder every year because we're getting pressure from people we don't know on social media who are saying these outlandish things that have no fact, no scientific research behind it, and influencing our patients to the point that we feel we're being put on the spot to justify and validate, years worth of science. So what are you hearing, if anything, from your own providers or your own staff about, uh, you know, uh, challenges or concerns related to flu vaccines or vaccines in general?
I'll start. So for us, being a primary care organization, that's all we do, primary care. We don't have anything else. And so one thing unique to primary care for anybody who's in primary care that's on the call, I think one thing unique to the primary care sector that maybe some of the specialists don't see is that there's that really strong relationship between the patient and the provider. Some patients have been seeing our providers for 20 plus years, some even longer than that, maybe since they were born. And so there's a lot of trust between that patient and provider. And so overall, when we look at our overall numbers, I don't think we had a huge impact because of all the kind of disinformation, misinformation out there. But that said, how it did impact us is the amount of time it took for us to convince our patients, hey, it's okay to get the flu vaccine, it's safe. And so, for example, if we talk about like that about 2 years ago, when we gave out a bunch of flu vaccines, patients came and asked for them, and it wasn't very difficult, even if the patient didn't ask for it, to convince them to get it. This year, I think our staff, our providers, have to spend extra time kind of explaining, maybe answering some of the questions that they may have heard that Amy was referring to through social media. So spending that extra time with them, I think helped a lot. And I don't want to. I'm not trying to promote one flu brand over another. One of the a lot of things that came up for us in the past was flu vaccines being made from egg products and they being allergic to it and they're not believing them. We kind of strictly used a cell-based technology. Again, I'm not going to promote the brand. I see someone on the call from the company here, but not going to promote the brand. But we kind of strictly went with that and kind of explained to our patients, this is a cell-based technology. There's no egg products in it at all. So that kind of helped a little bit as well. So those are some of the challenges. I think more than anything else is the time it took for us to time and effort it took for us to explain to our patients the safety and efficacy of the flu vaccines.
So for us here, it's pretty much the same. A lot of the patients who are being seen in primary care or any of our specialists, they have followed those providers for a while. So there is a level of trust built, but then there's a lot of questions about, oh, but I heard this and I saw this on social media, or, according to Jane Doe, her brother had the, whatever it is. It takes a lot of debunking. Providers have to, talk them through the medical evidence, and then our nursing staff, same thing. They basically, we deliver the same message all across the board to the point where patients remember. And then for us, I hate to always bring it back to this, but we were the epicenter during COVID, so a lot of our communities remember how bad it got here without the vaccine, how bad um like how bad family members had, what happened with their family members with COVID. Some did not survive it. So when we tell them about, we kind of compare it as well with COVID, saying, how the vaccine helped save a lot of people as well, didn't get people as sick. Same thing with the flu. And then we do tell them more people die of the flu than COVID, actually. And then, showing them data, speaking to them about data, telling them, maybe if they look on actual facts instead of following non-clinical people and just listening to various talks and such, they'll get a better idea. But for the most part is the trust that they've built with their medical team, and then having the entire team share the same message. Of course, we do have some staff members who will go around saying, oh yeah, that I don't believe in that. We tell them we respect your opinion, we respect your choices, but we appreciate if you don't go trying to convince other people of misinformation.
Yeah, I think one of the hardest things for a lot of employees and parents and patients to understand is that even healthy people who catch the flu can get very sick and may pass away. And it's always very shocking because no one expects someone to get that sick. And if you've never uh, connected with Families Fighting Flu, it's a great organization that does a lot of advocacy for flu vaccination, and almost all the members, I think all the members, are people who have had a family member pass from flu. And a lot of them were young people, 16 years old, 20 years old, who have passed away unexpectedly after having contracted the flu. Usually people say, oh, you'll be fine, you have the flu, but the flu can be very devastating to some. So I think that, there are some challenges and concerns even for parents who bring a family member, a child in to a provider, and the provider says, or the nurse says, oh, it's fine. They just have the flu. Just take them home and, let it just run its course. So it's important for families to know when you really need to follow up and when it's okay to just, let a child sit on the couch so that we don't have this number of 10,000 or more flu deaths in a year. Um, and so I have another question. If you were going to talk to others or your peers, the people on this call, about what lessons have you learned about preparing for the flu? So for next year, what lessons would you share with everyone about preparing for the flu season? When do you start? What do you really need to have? How do you connect with the community? How do you rally, the staff around the work? Do you share data with people? Does it matter to anyone or just to you, the data? What are some of the lessons that you would share with everyone about the flu season or preparing for the flu season for next year?
So here, at the end of one flu season, and we already start thinking about what is the theme for next year's flu season, right? We want to come up with something fun and engaging to get the staff excited, because although it's great to advertise it on social media and all these platforms and markets, the flu vaccine or vaccinations, I think our staff are our best marketers. They are our best promoters. So if they're excited and they're walking around with their t-shirts saying, I got my flu vaccine and it's cute and everything, that helps promote it better. So always coming up with a good, engaging theme, and then ensuring that staff are well educated, well informed about the benefits of the flu vaccine, and having everyone promote the same language, so to speak. And then sharing data, being transparent about how we're doing and making it competitive.
Okay.
Yeah, I
So
want to Yeah, I want to echo some of what Michelle said. If there is anybody on the call who maybe as a doctor or business owner that's currently not allowing your staff to get their flu vaccines, or at least not get it for free, I highly encourage you to rethink that. And the reason why is because I know we talked about flu deaths, but it also impacts business. If people get the flu, they have to call out sick. And this year, especially for this year's flu, I think it's the new variant that Amy was talking about earlier. It really hit hard for our staff. They were out for, usually flu, they're out for maybe about a week. It took 2 weeks, and even when they got back, they did not feel 100%. And so it really hurt us business-wise, with a lot of our staff being out. And on top of that, what Michelle was saying earlier, your staff is your number one kind of promoter of these flu vaccines. They can tell their own story of, hey, last year I didn't get the flu and I got really sick. I was out for 10 days. This year I got the flu, and it was much better for me. So they can help promote that for you. And so I highly encourage you to do that. I think that's the best advice I can give. As far as data goes, I think our organization is kind of working through that right now. Like I mentioned earlier, we've got various locations all throughout Georgia, Alabama, Tennessee, and so we've got a really large demographic. I tried to look up yesterday flu vaccine rates by race, for example, and I could not pull it up for us. I'd really like for us to work on that, just because, of course, there's that disproportionate vaccination rate between different races. And so as we work, because we are slowly transitioning towards more value-based care, more pop health objectives. And so one of the things that I would like to do for a challenge for myself and our organization is to get more data on things like that, and try to use that data to maybe target it more towards communities that are hurt more by the flu.
I think that's very sage advice. I think that's a great way of looking at things. Do we have any questions yet? If we have any questions yet. Okay, Ashley said, oh, she wants everyone to know that this is the first webinar of the year for National Minority Quality Forum. If you have any questions, put them into the Q&A chat box. And we'll try and answer all your questions if you have any. And the annual leadership conference is coming up. If you haven't been to the annual leadership conference with National Minority Quality Forum, highly recommend it. Is this coming April, and registration has already opened. Ashley put in the chat group, in the chat box there, the link for the 2026 summit in Washington, D.C. So you can go in. Is there a discounted rate for early registration, Ashley? Hopefully there's a discounted rate for early registration. I think there usually is. So you want to get in and get the early rate. And will you be, yes, she said there is. Are you, yes, for different disciplines. Will you be requesting poster submissions or anything like that? And Leslie says, see our respiratory vaccine resources here. There's a link for all of that. There's a question. Can you share any examples of working with patient advocacy groups and pharmaceutical companies to increase vaccination rates? Sam, do you have any pharmaceutical companies that you work with or
Yeah.
patient advocacy groups?
The only thing I can think of when it comes to that, so I guess I do have to name the brand now. Securus is the company that we use for our flu vaccines. And we got together with their scientists. And the reason why we did that is because a lot of our providers were not familiar with what the differences were between different types of flu vaccines. And so to meet with our scientists and have our providers meet with them, I think that really helped because that gave our providers a lot more information about specifically the Flucelvax and the flu vaccines, which we previously we had mix of flus in the past, but this year we kind of went exclusively with those two. And so I think that helped kind of promote the flu vaccines with the community just because the providers were armed with a little bit more information about them. As far as patient advocacy groups, really, like I talked about earlier, it was just a matter of us knowing that some of our patients that were coming in were prominent figures of the religious community around rural Georgia. And so when we were able to talk with them and ask them to help us promote flu vaccines because it had impacted their communities greatly in the past years. And so it really helped to have that relationship with them and they were, of course, on board with us coming into their churches, spending about 5 minutes to talk about flu vaccines. So that's the only thing I can think of right now. Thank you.
So for us, because we're a public entity, we're not allowed to, or we shouldn't push one variation over another. So we don't really work with pharmaceutical companies itself, but we do work with a lot of patient advocacy groups, politicians, assembly members. We work with a lot of religious organizations. As a matter of fact, this past year or over the summer, we've had some religious organizations reach out to us to ask us if we're able to table in their churches. Even even churches that were outside of our community, they heard about, how much we are advocates of flu vaccination. We provide free flu vaccines to the community during our events. So they've actually reached out to us from another, community area that's they actually have we have another sister facility in the health system located in, say, the Jamaica Queens area, but they actually reached out to us because they've heard of us through other members or people who actually goes to their church but lives in this community. So it's, word of mouth, working with various religious organizations. And, for us, maybe our next steps were to hit up like the barber shops, hair salons, who knows?
Do any of you work with different insurance plans or managed care companies about improving your flu vaccination rates, or do they have any stake in this?
So we do have two plans that we work closely with, Metro Plus and Health First. For the most part, we work with Health First closely with when we do health fairs, they're always there to participate as well. So they help us advertise our health fairs on their social media, and they're very present for us as well.
Yep, for us, I mean, we use prominently our social media sites. It's not as difficult as you would think if anybody is not doing that. And so I highly encourage you to do that. It's a good way to promote not just flu vaccines, but your business while you're promoting flu vaccines. And it's, obviously at a very little cost. And so if you're not doing that, that's another suggestion that I can give to everybody is looking into making short, easy, 15, 20-second TikTok videos, just talking about the efficacy or the benefits of getting the flu vaccine. So I encourage doing that. Thank you.
We're gonna have to check that out. I wanted to let everyone on the webinar know that Leslie has posted the free quality improvement toolkit, also known as Drive. And she notes that all of today's panelists have carried out successful projects using the framework from National Minority Quality Forum. That is true. So if you check out those resources, I find them very helpful and hope you will as well. Any other questions before we start to wrap this up for today? I see we're getting towards the final 10 minutes of the hour here. I think there's a question. I'm curious to know if the data has ever highlighted any specific demographic that had low vaccination rates and what tailored intervention was created, implemented to successfully improve rates for that demographic. I think that I know here at Elmhurst, yes. So,
So historically, whenever we looked at our vaccine rates year over year, our Black African American communities were always the lowest vaccine rates. And we kind of understand why, they have hesitancy and fear of anything medical based off of historic experiences that population may have had. And we've always worked on finding ways to promote it more to them, to, reinforce that it's okay, it's safe. One year we had a nurse practitioner who is of same or similar, they look and talk similar, and they were able to connect with their cultural backgrounds, and they were able to promote the flu vaccinations. And then from there, so little by little, she was able to convince patients to get their flu vaccines. Again, as I mentioned earlier, it's funny how this year our Black African American group has a better vaccine rates than our patients who identify themselves as white, when in the past it was actually the opposite, where the vaccine rates for patients who have identified themselves as white was better. But of course, our other races, Hispanics, Asians, and such, their vaccine rates are pretty good, but we do still continue to promote to them as well. But we do tailor some of the languages and connections for the ones who are at a lower rate.
I think we also looked at the data and we were struggling in one department for the staff and the patients. Both the patients and staff in the same department weren't getting vaccinated. So I was like, why is the message not getting out over there? So we took a very strategic approach in our behavioral health department to ensure that we did a little bit extra, and we're doing a little bit extra to try and improve the vaccination rate there. And sometimes it just means being just a little extra sweet there. And Michelle will tell you she's done a number of cookie runs to get that sweetness level up, to get the vaccination rates to go up higher. So
And
that's,
then
yeah.
our flu fairies paid a visit. So it's cute how patients in our inpatient behavioral health areas, they're shocked when they see staff walking around with fairy wings, male and female. And it kind of gives them a little chuckle and a giggle. And then they kind of forget the reasoning why they probably didn't want the flu vaccine to begin with. I mean, it helps, of course, a little cookie, they'll get a little cookie reward at the end. But just having staff members wear little fairy wings up there, and it's like, holy smokes, look at that nurse. They're wearing a fairy wing. It's just like blows their mind.
Great. So Christina has a question. She's asking both of you, has the flu campaign helped change your perspective on outreach with other vaccines? And if yes, how?
Yeah, as I was mentioning earlier, a lot of our patients tie in vaccines together. And so if we talk about kind of the vaccine hesitancy goes right around that pandemic time when COVID vaccines first started coming out, there was a lot of misinformation and information about COVID vaccines. I think from there, a lot of our vaccine rates overall kind of tumbled, not just with COVID vaccines, but just vaccines overall, from MMR vaccines, even the hepatitis vaccines. We can see our data decreasing even slightly starting that period. So I think there is some tie-in between how patients view not just a specific vaccine like flu vaccines or COVID vaccines, et cetera, but how they just view vaccines as a whole. We had a challenge, especially with RSV vaccines, One, because it's such a new or a relatively newer vaccine that we had previously not promoted. And our providers, especially some of our younger providers that maybe have a little bit less experience, they just didn't have a lot of information about the newer vaccines coming out. So I think one of the challenges for us was getting that information and education out to our providers regarding all the newer vaccines coming out, whether it be RXV, Abrysvo, and the other newer vaccines for other diseases as well. Capvaxive is another good one that we really started promoting a lot of more educational material, a little bit more meetings with the pharmaceutical companies to make sure that all of the providers have some of the information, the latest information when it comes to these vaccines. Capvaxive is a really good example. We've had pneumonia or PCV vaccines for decades, but it keeps on changing over time. We've had Pneumovax 23, Prevnar 28, we have Prevnar 15 at some point. And so with the new Capvaxive coming out, I think it really helped for us to really push the education about the vaccine along with the vaccine itself. And that really helped to kind of get more patients vaccinated for PCV.
So for us here, how we tied this in, as everybody's promoting and informing patients about the benefits of the flu vaccine, and one great thing we did here was we transitioned a lot of our vaccines or preventative vaccines, I guess you would say, into NPSO. So you don't really need a provider order. The nurses are able to administer it. And usually, when they're with the provider, they tell them all their medical issues. And when they're at the nurse does they close the loop of the visit and they go back and take a little look again and administer the flu vaccine. And then they'll also check for other vaccines that may be due. So our nurses are one of our biggest promoters, and they're able to just administer vaccines without the provider actually placing the order. So such as shingles vaccines or pneumococcal vaccines, even the hepatitis B, they're able to take a look, and then they'll inform the patients, oh, we see that you also do for these vaccines, and here's the benefits similar to the flu vaccine benefits, or it'll help prevent XYZ. And then oftentimes patients like, what, I'm already getting one vaccine, why not? Just give me it all.
Okay, another question. This one comes from Esther. This is a suggestion regarding administering vaccines on evening and night shifts. In healthcare organizations in which I worked as an employee, occupational health nurse, our employee health department trained nurses to be flu champions to administer the flu vaccine to colleagues on their units and departments. What do you think about that? Can we train other staff to be the flu champions at night and vaccinate overnight and then report back the paperwork to OHS the next day?
I think that's a fabulous idea. That may be something we'll look into in the next flu season.
Yeah, we don't have overnight shift for our organization, but that said, one thing I do want to echo is something that Michelle was saying earlier about having the staff, giving them the ability to vaccinate without a provider have to instigating that order. I think that's one of the things that really helped us out a lot. If there's anybody on the call that is currently not doing that, to give your staff a kind of a standing order. I would encourage you to make it official, put it on like an SOP that says, as the provider, I'm allowing my medical assistant to vaccinate patients. You can even put a demographic of between a certain age, whatever criteria you want to put, and allow your staff to vaccinate patients without the provider themselves having to initiate that order. It'll take a lot off your shoulders. I know some providers will hear that and they might get scared off or get anxious a little bit. But it is something that happens all the time. It is definitely compliant. And it's something, as long as you're trusting your staff, and if there is staff that you've worked with for 5-10 years, and you're understanding their ability to recognize conditions, I think you'll have a lot more success getting flu patients vaccinated with the flu if you were to implement that standing order process.
Yes, Esther says the approach actually increased uptake of the flu vaccine by staff. And then the staff, like here at Health and Hospitals, you get like a little sticker on your ID. And that the thinking was that coworkers and patients seeing the sticker would be encouraged to receive the vaccine and or have a conversation about it. So great job, Esther. We totally agree with you on that one. We are now at 12:59. If there are no other questions, I would like to thank our panelists today, Michelle Lamb from New York City Health and Hospitals Elmhurst, Sam Park, he's our Vice President of Ancillary Diagnostic Services from Southeast Medical Group and Southeast Primary Care Partners, as well as Brandon Garrett, Leslie Zuniga Rivas, Ashley Hill, and Chini Ukachukwu from National Minority Quality Forum. Thank you so much for being here and setting this up. We all know a little bit more about flu and all the ways that we can be better flu champions, flu vaccine champions. We don't want to champion the flu. Thank you so much for joining us today, and stay tuned. We'll be sending out more information soon about the next upcoming webinar. Thank you so much.
Thank you, everybody.
Thank you.
Bye.